Hello, good evening, and welcome to Continental Live. My apologies, first and foremost, we are slightly behind our schedule as Dr. Mohanty had to tend to an emergency. Sir, thank you so much for taking time and being with us this evening. Friends, today we are talking about primary preventions in cardiovascular diseases. With us is Dr. Abhishek Mohanty, who is the consultant for interventional cardiology at Continental Hospitals. He has an MD in general medicine and he's a gold medalist in DM for cardiology. Vastly experienced in advanced and complex interventional cardiac procedures such as arterial appendage closure, TAVI, PFO device closure, endovascular repairs, complex coronary and peripheral angioplasties and congenital heart diseases. Sir, thank you so much, as I said, taking time
Thank you so
from
much.
your busy schedule and talking to us about primary preventions of cardiovascular diseases. Friends, if you have any questions, feel free to drop them in the comments section, and Dr. Mohanty will try and take as many of those questions as possible. So let's get our discussion underway this evening by understanding first and foremost what are cardiovascular diseases and what causes them.
See, cardiovascular disease is a big term. So it comprises of all the disease that can affect the vascular system of our body. As you know, all the organs receive blood supply to blood vessels. So any of those blood vessels, if they get affected by any reason, maybe because of cholesterol or maybe because of inflammation, that can result in organ damage. So if these blood vessels are affecting, blood vessels supplying the brain are affected, then you may develop stroke. If your blood vessels supplying your heart is affected, you can develop a heart attack. If it affects your kidneys, you develop kidney failure. If it affects your limb, you can develop ulcers. You can develop severe pain and gangrene in your limbs. If it affects your liver or your intestines, your liver and intestines will necrose, and you will develop liver and intestine failures. So any disease of the vascular system of the body comprises of vascular disease. Specifically, if you're cardiovascular disease, specifically, usually we see the main vessel of the body, that is the aorta and its main branches, and the arteries that supply blood to the muscle of the heart.
Right.
So
So, for the benefit of our viewers, if you can just help them with some examples, because many times all these terms are loosely used: cardiovascular diseases, heart disease, cardiac diseases. All of these terms are used interchangeably. If you can give us some examples, that will help our viewers today.
this basically cardiac disease is different. Cardiovascular disease is different. So cardiac disease, basically any disease of the heart, comprising the muscle of the heart, the valve of the heart, the electrical system of the heart, the arterial supply of the heart muscle is known as a cardiac disease. And cardiovascular disease is something different. It only comprises of disease that affects the arteries that supply blood to the muscle of the heart, and the artery that originate from the heart. So if those vessels affected, then it's known as cardiovascular disease. So it's a large term. So any vessel of the body, if they're affected, that can be termed as a vascular disease itself. Okay, so
Right.
cardiovascular disease is a broad term. Cardiac disease, one part of cardiac disease is cardiovascular disease, but there are multiple other diseases like valvular disease. Valvular disease doesn't come under cardiovascular, so it's a cardiac disease. Then the wiring system of the heart gets affected. That some of these patients may require device therapies like pacemakers, AICDs, CRTDs. So that's different. So that's a different class of patient. Then we have patients who come with structural heart disease, like congenital heart disease. Those who have holes in their heart since birth, or those who have abnormal connections in the heart, in the arteries. So those comprise congenital heart disease. Sometimes can be acquired also. So
Right.
it's a broad term, and so not be used loosely. But again, it's okay. I mean, for others, I mean, for layman, if you start differentiating everything, it will be difficult.
Right, right. So, friends, as you're joining us, I see many of you joining on Facebook and YouTube. We are talking to Dr. Abhishek Mohanty on cardiovascular diseases, or rather, primary preventions of cardiovascular diseases. This evening, sir is answering questions of and about these diseases. So, if you have any questions or comments, feel free to leave them in the comment section below, and I will try and have Dr. Mohanty answer these questions. Sir, one of the factors which we are seeing is that in the modern lifestyle, in this fast paced lifestyle, especially in big urban areas, there is an increased incidence of cardiovascular diseases. So, can you help us understand why the urban modern lifestyle is such a risk factor for cardiovascular diseases?
So it's basically lifestyle. So we know that one of the important factor responsible for cardiovascular disease is our lifestyle. So the major risk factors for cardiovascular disease can most of which we usually we know. So they are like your diabetes, your blood cholesterol level, your hypertension, then your underlying conditions like inflammatory system, inflammatory abnormalities. Then it can be because of age, family history, genetic factors, and then comes smoking, alcohol, and your eating habits. So
Right.
basically, we don't have any control over age, genetic factors, or family history. So these are like non-modifiable factors. The thing that is in our hand is controlling your diabetes, your cholesterol, your blood pressure. You can stop smoking, you can stop taking alcohol, and you can be particular about exercise and diet. So the problem is that with what we see in younger age group nowadays is that there is probably a pandemic of smoking and alcohol in our country right now, especially in younger age group, and the diet is hayward, and most of them are stressed out. So stress is also important risk factor for all these diseases. They don't have enough time for exercise, or they don't. I won't say they don't have enough time. The thing is that there's lack of motivation regarding exercise and proper diet. So everyone has time. So however busy they are, they can take 30, 40 minutes time from the busy schedule and go for exercise. But motivation is required. Even if you have time, motivation is lacking because of stress and other factors. So multiple things have resulted. So it requires even if all are educated, requires good amount of motivation to improve their lifestyle and to decrease the increase in incidence of cardiovascular disease that we're seeing nowadays, especially in younger age group.
Right. So, would it be right to say that today the profile of patients is moving to a younger demographic, let's say, rather than a decade or two ago? And what exactly is causing this downward shift of age groups?
Yeah, still the most of the patients are in the elderly age group because age is one of the important risk factors, and most of the elderly patients are diabetic, hypertensive, or they have other risk factors. But still, then as compared to what it was like 20 years, 30 years back, the number of patients presenting with cardiovascular disease, especially in the younger age group, has significantly increased. And I think it's basically and not only cardiovascular disease, the incidence of diabetes, high cholesterol, blood pressure, obesity have significantly increased in these younger age group patients, and that automatically transfers into higher incidence of cardiovascular disease. So, and part of it is lifestyle. So it's basically basically, and most of them are smokers now. Many of these patients, if we take a history, will have long. I mean, we have patients coming in 20s and 30s with major heart attacks, and we take a history. Most of them will be smoking by the age of 10 to 15 years, which is really surprising. But they'll be smoking or taking alcohol since that time. So these are all preventable disease. So provided we take proper precautions and we improve our lifestyle. Of course,
Right.
because of this lifestyle, the demography is shifting. So that's why it's important. So that's why all the guidelines nowadays, even the WHO and other guidelines have decreased the age of screening, the minimum age of screening for patients. So previously they used to start screening in 40 years. Now after that came to 30 years. Now after 20 years, everyone has to get the basic checkups done because we know that younger patients are at high risk nowadays.
Right. So you mentioned lifestyle in what you were saying right now. So if you can look at the urban age group of people, especially in the IT and the middle class, the urban middle class. So what kind of lifestyle factors do you think are possible for modification, which will really help them improve their cardiac health and prevent cardiovascular diseases?
So that varies from patient to patient. So, but the general thing is after 20 years of age, everyone should check their blood sugar and cholesterol and BP once a year. And if it is abnormal, then the physician will tell you like at what frequency it has to be rechecked. And then, of course, your exercise and your lifestyle, smoking and alcohol. So that smoking, absolutely no. Alcohol, like social drinking, is okay, but as much as possible, it should be avoided. And and your exercise. So that is what which is like lacking a lot. So the recommended guideline is minimum like 150 minutes of exercise per week, which I'm sure is not followed by most of the people, even if they know. So that's where like motivation comes into fact. So they have to be motivated. Even if they know that smoking is bad, they know that exercise is good for your health. Still, then that motivation to do that thing is lacking.
Sure.
So that's why health checkup is also important. So health checkup is not like doing a health checkup, doing a blood test and all the tests and then going back home. So once you do a health checkup, you need to meet your physician. The physician is the one who is going to guide you regarding this thing. And important thing is that they can motivate you also. So you may not listen to your colleagues or your family members, but most of them do listen to their doctors. So that's the
Right.
advantage of consulting a physician after doing a health checkup. Most of them do health checkups and then sit at home. They don't see the report. They don't see the physician. That's also not advisable.
Right, right. So you mentioned health checks. So how frequent should they be? And can we really say that it either helps prevent or delay the onset of cardiovascular diseases?
It does. It does delay the onset of cardiovascular disease because you are controlling your risk factors. The main thing in primary prevention basically is if you're preventing cardiovascular disease from happening. So the main thing in primary prevention is controlling as many risk factors as possible. And most of these diseases are silent diseases. You don't have any symptoms because of hypertension, diabetes, and cholesterol. So they are all silent killers. So unless and until you check your BP, cholesterol, and sugar, you'll not know that you are hypertensive, diabetic, or have high cholesterol. So by the time you check, it may be too late. So that's why every year, those who don't have any other history, like for primary prevention, every year, so everyone should at least get their blood sugar, BP, and cholesterol level checked. And if you have any symptoms, then accordingly, your physician will advise you the other tests. Like some people having symptoms, and in India, um, that's related to something not cardiovascular, like your hemoglobin level, your thyroid levels. So those things also probably based on your symptoms, the physician may advise. But even if you don't have any symptoms, you need to check your blood sugar, cholesterol, and BP at least once a year. If it is abnormal, then your physician will advise you like at what frequency you need to come back and get the test done, and whether you need medicines or not. And then your lifestyle, diet factors, other things they will tell you, and they may try to find out the cause of early onset of those abnormalities also.
Right. So now, because we spoke about the younger profile of cardiovascular patients, even if it is not a norm, there are enough cases I'm sure you see in your practice. So, what if somebody is diagnosed at an early age, let's say in their mid 30s or even late 30s? So, what kind of things can they do to one, deal with the condition and to have a normal, healthy life?
So basically, there are two categories now. If someone has been diagnosed with a risk factor, treatment is different. But if someone has been diagnosed with a cardiovascular disease, the treatment is different. So if someone
Okay.
has already been diagnosed with a cardiovascular disease, then what we are doing now is secondary prevention. So to prevent progression of disease or repeat major event, cardiovascular event. And if someone has been diagnosed with a risk factor of a cardiovascular disease like diabetes or hypertension, then the important thing is to control them properly so that it doesn't progress and doesn't lead to cardiovascular disease. So, for example, if someone is diabetic, they need to consult with a diabetic specialist, and they will advise you like how to do it, how to manage. Hypertension again is an important thing, and many times we see in our practice that hypertension is diagnosed very loosely. So diagnosing hypertension is important, but you need to take your physician into consideration for diagnosing hypertension and properly evaluating it and getting yourself treated. For cholesterol, same thing. There are different guidelines for different class of patients. We usually classify them as very high risk group, moderate risk, and low risk group. There are certain criteria for that. So based on your risk profile, we usually first stratify them in the risk category, and then accordingly prescribe medications or lifestyle management or dietary changes.
Right. Friends, this evening we are having a conversation with Dr. Abhishek Mohanty on the primary prevention of cardiovascular diseases. As he's been talking about, there is an increased incidence of cardiovascular diseases, and that is largely fueled by lifestyle factors in the urban urban areas. The modern lifestyle does make it a little more riskier for you to get cardiovascular diseases. So if you have any questions, whether it is on your lifestyle, whether it is on your cardiac health, or any other cardiovascular related subject, feel free to drop your questions in the comment section below, and Dr. Mohanty will try and answer those for you, sir. I know you have a very busy schedule, so I will take a few more questions, and then we'll let you go back to the patients who are waiting for you. So, first and foremost, I would like to understand what kind of advancements do we have in terms of treatment? What kind of prognosis do people have? Because not so long ago, it may have been a very serious thing for you to have been diagnosed with a heart condition or a cardiovascular condition. But what kind of advancements have come about, and how easy is it now to manage these conditions?
So advancement, there has been tremendous advancement in cardiovascular science, not in cardiovascular, in entire medical fields. Everyone knows. So almost like every month we see something new. So basically, in terms of technology and how to diagnose and treat a patient. So treatment has become very much objective now. Previously, it used to be very subjective. Now, some people, if you go with the same kind of cardiac report or cardiac abnormalities to a doctor, they will tell something, the other person will tell something. So ultimately, the patient gets confused. So now there has been a lot of objectivity to the treatment also. Along with subjective part, we can go for a little objectivity so that it helps in managing the patient. So and that has happened because of advancement in the technology. So there are multiple tools available in our in our department, in overall in cardiovascular department, where we can diagnose multiple things which we are not able to diagnose frequently, and treatment also has become very much significant. Previously, many of the patients who have been referred for surgery because of certain conditions like a bypass surgery or a valve surgery, or a device closure, or for a congenital heart disease, now are being managed without surgery by doing a minimally invasive procedure, which can be done in the cath lab itself without any kind of anesthesia. So that's because of advancement. So that advancement has helped treat many patients which were not, like, who were actually needing open heart surgery, but were not rendered fit for surgery because of other comorbidities. But because of advancement in other technologies, we are able to treat those patients without surgery also. So there are a lot of it depends on like what kind of disease you have. Based on that, we can advise and treat patients by doing minimally invasive procedures without doing any kind of major surgeries also.
Right, right, sir. If we talk about the advancements, obviously, I'd like you to dwell a little bit of light on the kind of facilities we have here at Continental Hospitals, and how qualitative cardiovascular care can be provided to patients here at Continental.
So basically, we have basically all the diagnostics and the therapeutic, modern therapeutic interventions available at our disposal. And the great thing here is that we use all those tools to diagnose the patient, and also to decide whether the patient requires anything more than medical management or not. So it's not like in olden days when you just diagnose disease, advise blindly advise either intervention or a medicine. Nowadays, there are multiple tools available to help in the diagnosis, whether the patient needs only a medical management or needs some surgical intervention or minimally invasive interventions. So we have multiple things at our disposal in the cath lab, in the diagnostic area, in our radiology department, which helps in the diagnosis and the treatment. For example, we are in doing minimally invasive valve surgeries without surgery, like that's known as TAVI, or we do valve procedures in other patients who had valve failure without doing surgery. Then I'm not going too deep into those things because it will be too technical. Then we do angioplasties in patients who were previously referred for surgeries only, but they are not fit for surgery, because we have multiple things at our disposal nowadays where we can do angioplasties, complex angioplasties like peripheral and heart angioplasties, in patients who have previously rendered not fit for even angioplasty. So there, then similarly we have multiple newer technologies available like OCT, FFR, IVUS, which helps in proper diagnosis of vascular disease. And also after a procedure, we can optimize our results based on those findings. So it's not based only on angiogram nowadays. There are multiple other tools are nowadays available for this treating vascular disease. So this is just a small example. It's a vast field, but it will take a long time to explain everything. But for all type of vascular disease and cardiac disease, we have newer tools available, which helps us in diagnosing and treating a patient efficiently. And many times we manage to treat them even without doing a major kind of surgery.
Right, sir. So I think with that, I have come to the end of the questions that I have. Friends, those of you who are watching, if you would like to contact Dr. Mohanty, you can see the number scrolling on the screen. Feel free to give us a call for an appointment and a consultation with Dr. Mohanty. If you would like to know more about our hospital, do visit our website or our social media pages, and we'll be back with you soon with another interesting topic. Sir, thank you once again for taking your valuable time and joining us. Thank you to the audience who are watching us live and those who will watch us later. If you like this broadcast, do share it with your friends and family. It may be of help to someone. Until next time, from Dr. Mohanty, myself, and everybody here at Continental Hospitals, it's thank you and goodbye.
Thank you.